And so I look forward to this conversation by a little bit of introducing what Lifesten does. I think they really covered my experience and my work with NCDs. So yeah, those are my names, and I've worked in the healthcare space for I think close to 10 years now, but mostly focusing on chronic diseases in sub-Saharan Africa. So kindly let me know if you can see my screen, and then I can take you through a small presentation, and then we take it from there. Can you guys see my screen?
Your screen is visible.
Yes,
Thank you.
it's visible too.
Thank you so much. So yeah, the company is Lifesten Health, and I co-founded this company towards the end of 2021. I met my current co-founder. His name is Stephen Ogueno. He's Kenyan, and we met through an entrepreneurship program. So through my experience working as a nutritionist, as I mentioned, I mostly get to work with people with chronic diseases, and I always felt like the preventative side was something that was left out, despite how very important it is, especially when it comes to lifestyle diseases. So we had the same vision. My co-founder was working on something similar back in Nairobi, and we're like, let's do something together, and then start in Rwanda with the aim of moving into other African countries. So our primary aim at Lifesten Health is changing personalized healthcare or how it's provided in the African context. So as an overview, why we're doing this, the problem we're addressing is that with the rise of modern lifestyle, now everyone drives themselves to work, but also the eating habits, physical inactivity, work-related stress, etc. It increases the health burdens to the individual level, but also the healthcare system. And this simply means that depending on the modernization of our lifestyle, it comes with different diseases, lifestyle diseases like diabetes, hypertension, and others. So in Rwanda, where we're based, there is increased rates of these diseases, and currently 6 out of 10 mortalities are being caused by NCDs. In addition to that, 55% of all hospital admissions in Rwanda are also caused by these diseases. And despite this rise of lifestyle diseases, there is still a lack of guided, personalized, holistic care. And I think even from your experiences, you usually see that if you're to meet a nutritionist, you go to a different clinic. If you're supposed to have your test done, you go to a different lab. If you have to meet a certain expert in a certain field, you find them elsewhere. And we don't necessarily have a joint space where all those specialties come together to address these lifestyle diseases. And as a result, people are demotivated to go through the whole healthcare system, especially at the preventative level. So that's what we're working on, or what Lifesten is doing. And our solution is based on the three main pillars when it comes to addressing lifestyle diseases. The first one is the physical health, mental health, and nutritional health. So all our solutions revolve around those three pillars. And these are some of the key features of our solution. So our solution is divided into two. One part being the completely digital part, which is the Lifesten mobile application and the dashboard. And then there is the community approach, where we're able to train community Lifesten ambassadors who act as the contact person for anything related to non-communicable diseases in their own communities. So for the key features, first we've designed personalized incentive-based programs. And what this means is that we design small small programs or small challenges under the 3 pillars I mentioned: nutritional, physical, and mental. So this can be a small workout, tracking your steps, tracking your sleeping schedule, following a meal plan. So it's a small activity, but every activity is allocated points. And depending on how you're performing, if you're achieving your goals, then you collect points as you go over time. And these points are redeemable for actual services. So we've partnered with health and wellness service providers, and these people offer free passes or discounts on their services, depending on a certain amount of points our users have collected through the application. So two, there is the AI-based health screening. We've recently, in last year, we've integrated transdermal imaging technology, and this is a technology that allows you to screen your face for 30 seconds, and then you're able to get your blood pressure, facial age, BMI based on the information you've put in before, and then the overall risk assessment of if you're at the risk of developing an NCD or not. And then we have the community health initiatives. So you have an option to create or join an existing community on the platform. And this is simply for motivation. So if you want to do a challenge with your friends, with your family, you have a space to do that. And it comes with a leaderboard where you're able to see how everyone is performing. And then the recent one is the corporate wellness dashboard. And this is specifically for our business-to-business angle, where we design workplace wellness programs, and I'll get to talk about this in the following slides. So this is how it works in simple terms. So you download the mobile application, you sign up. The sign-up process takes slightly longer compared to other apps because you want to get as much background information about you and your habits as possible. And then, depending on the information you've provided, we curate personalized plans, still under the categories I mentioned: physical, mental, and nutrition. And then, well, over time, you're able to engage with the different activities on the application and track your progress over time. So you can decide to be involved in the communities. As I mentioned, create yours or join an existing one. And then you can go now to the screening, the AI health screening for blood pressure. So as you can see on the screens, the first one is the leaderboard, which literally shows your position in comparison to everyone, depending on the points they've accumulated over time. And then the one in the middle, as you can see, is the 3 categories I mentioned: your performance under physical, your performance under mental, and your performance under nutritional. And then the recent progress, we're able to see the steps you've taken. On that day, your blood pressure, heart rate, depending on your recent screenings. And then there is this screen with the tests. The first one is the automatic facial scan. This is the transdermal technology I mentioned. The second one is the BMI, depending on if you've given us your height and weight. And then there is the blood sugar. Blood sugar, you put in this data manually. And this is for people who, let's say, are already living with diabetes. So now they have a tracking system where they can see how they've been doing in relation to the habits they have, or how they've been doing overall for wellness and health. And then there is the mental health. So for mental health, we have standardized global tests for anxiety, for example. So you can sign up, do the test, and immediately get the results. So this is how big the market is. Worldwide, 75% of mortalities are caused by lifestyle diseases. And we went with the digital approach because 60% of the population in Rwanda, they're young people, and the smartphone penetration is actually high. And this is a picture of one of the outreach activities we had done. We had people coming in for the screening, and it was part of a research where we were testing the AI screening in relation to the normal CAFS screening. So our business model is simple, it's subscription-based. The first one being the B2C, where a user can decide to pay for personalized plans. If I want a personal coach, personalized meal plans, I can pay for those services. And if not, we still have the freemium version where everyone can go through all the features I've mentioned, but they have limited capabilities. Number two, which is the one we're currently focusing on, is the B2B2C, where we design corporate wellness programs. So these programs, when an employer pays, the employees get access to different packages under the three categories I mentioned. So this can be a gym membership, quarterly screening for nutritional consultation or mental health consultation, and it's built on a rotation basis. So as a user, you get to choose, what do I want to focus on for this quarter? And then that's what you get. And then you can keep changing. You can keep changing on the quarterly basis. And the corporate gets access to a dashboard with, of course, anonymized data, population level data, where they're able to see this percentage of our employees. Maybe they're above this age, and also this percentage is living with lifestyle diseases. This other percentage is at a risk of developing one. And the future plan is to integrate this into an insurance model where we're able, depending on your habits and how you're performing overall, then maybe you can get different discounts or different packages for insurance. So this is our third year. We turned 3 years this year in February. And this is what we've been able to do so far. So as I said, we launched in 2022. We had an MVP and got our first 1,000 users. And in 2023, we got our first government project in partnership with the healthtech Hub Africa, and was funded by the Novartis Foundation. And we're able to raise 325,000 USD. So through this project, we're able to reach close to 2 million people with access to information, screening, but also referrals with the health facilities that we work with. And in 2024, last year, we were able to hit our 10,000 user milestone and also get to more than 60 public and private partners. So this includes healthcare providers and also private health and wellness service providers. So for this year, 2025, we're looking to sign up our first 10 B2B clients for the corporate wellness programs, open an office in Nairobi, and raise our pre-seed round. So this is how we're planning to use the funding. A big percentage is going into sales because, as I mentioned, we're initiating our B2B approach. So the acquisition of the B2B clients, and then 20% product improvement, but also increasing the team and the sales team to at least 10 people to increase the capacity. So over time, we've gotten support and investment from different programs, including the NVIDIA program, Google for Startups Accelerator, AGGP, among others. And this is the team, myself and my co-founder, Stephen Ogweno, who has worked in the healthcare space for many years, specifically focusing on NCDs and research. And then we have the development lead, partnerships, who mostly works with the service providers. Joseph, who is the programs lead, mostly focuses on the outreach activities and the work that we do with the community agents or community ambassadors. And then we have marketing and the sales lead. So in short, if this was short, this is simply what we do. We're trying to change mindsets from I think I'm healthy to I know for sure, so that people know how they're doing and what they can do to improve or maintain. So thank you. And if there are questions now, I can take the questions. Okay. I've seen the first question from Spencer. If we work with MOH, health workers in Rwanda on the community engagement part, yes. So our work, we mentioned the B2G project, the government project we did in 2023 to 2024. So some of the implementation partners included the Ministry of Health and RBC. So we mostly work with RBC as an implementation partner, and the community engagement and the training, the link with the healthcare facilities, it all goes through RBC. So MOH only comes in with the on the research aspect because it has to go through the National Ethical Committee, which is under the Ministry of Health. But that's how we've been working with them so far. And for Patty Mutesi, with insurances, so far, no, we don't. Currently, we don't work with any insurance company. And the reason to that, that's a long-term plan. The reason to that is that the first step this year, we want to bring on board multiple B2B clients. And the purpose of this is that we're able to get a data bank. And depending on the analytics we have and the data we were able to collect over time, then it will be time to approach the insurance companies with the tangible data. So currently, no. Any more questions from the audience? Thank you, Kevin. So I'll say the challenges are many. And the first one is the regulations. So it's a very, both the health part of it is very regulated, but also the tech part is also over-regulated. And the biggest issue is that these two different segments, they don't necessarily work together. So if you go to the health sector or the health ministry, they're like, that's a technology solution, you should be talking to the Ministry of ICT. And if you go to the Ministry of ICT, same thing. It's health, you're dealing with people's medical information, you should go to the Ministry of Health. So you don't have like infrastructures and regulations in place that really are clear to navigate. And one of them is that in 2023, we spent more than 9 months looking for data approvals, the data processing, data storage, data sharing, etc. There are very many certificates. And it was taking long because we don't have a lot of health tech, I'll say, innovations already. So it's a new space and the regulations are also new. So at some point you have to work side by side with the regulators to set them up. And this just means that you're using the time that you don't even have, that as a startup you cannot afford to have. And the other one I would say is obviously access to funding, because for health tech companies, it takes time. It really takes time for you to get to the level of traction you're looking for, or the level of attraction VCs and funders are interested in. So because you have to go through the regulations I've mentioned, you have to test whatever solution you have thoroughly for you to bring it to the market. And like many other sectors, you don't have the opportunity to test something. You cannot test on people's health. So you have to test internally and bring out on the market something that really, really works. This means time. And that's also one of the challenges we've had. And about the question on the challenges we faced in scaling up, the regulations, that's a very big part of it, but also now with the current focus on the B2B clients, we've noticed that with the how things are set up, usually it has to go through a tender for you to come in as for you to get that market, to be a service provider. But a startup cannot compete with a company. Startups are not even qualified to apply for tenders. There is, let's say, a minimum amount you need to have in the bank. There is proof of where you've done this elsewhere, where you've acquired this type of market. And that's the biggest issue we've had over time, navigating the corporate world when it comes to market acquisition. And the angle we're using, or the angle we're trying, is going through HR companies, which already have working partnerships with different companies. So we come in and then we're able to attach ourselves to the services these HR companies provide. And from Kevin, the average price for patient data license. So it's not actually, it's free. All the certificates from the data protection office, they're all free. They just ask for multiple documents, endorsements from different ministries, etc. But they're all free. And yes, you have to renew it. Like the first one we got, already the data controller and the data processor, we've already renewed them. And one good thing about it is that for the second renewal, now you get 5 years instead of just 12 months. So yeah, you have to renew them after 12 months. With this new ones, 5 years. So I'll say for the programs, the first one is the healthtech Hub Africa. It's based, the hub is at Noscan, and the reason why this has been crucial to the work Lifesten is doing, this is one of the very few programs where all the work is focused on health tech. So, and one of their key goal is to connect the startups to the public-private space or ecosystem. So that has really helped our journey. They've really connected us to, I would say, people and initiatives that would never have been able to reach on our own. So that's one of them. And the other one, I would say the Google Accelerator. We're able to see what's being done elsewhere, because it's an international program. So you're able to see different innovations, different products and startups and what they're working on all over. And I believe this kind of changes your mindset, and you're able to borrow some few ideas from the participants or the conferences you're able to attend through the program. Ethical clearance. Okay, thank you, Spencer. Thank you for that. I'll take more questions if there are any. So trademark, yes. So acquiring a patent, that's something that's still ongoing. We don't have it already, mostly because we started the process in 2023. So what they do is they give you requirements of everything you need to bring and how much you need to pay. And we haven't even finalized that. We're like, we need to be at a certain level of traction for us to even go ahead with this. The challenge comes in because some of the clients you're approaching require you to have this already. But yeah, that's still ongoing. We have it for the technology, specifically for the transdermal imaging technology, but then for the overall features and the functionality, not at the moment. Adequate ecosystem? No, definitely not. And this is the reason why I believe there is a very huge gap when it comes to the health tech ecosystem in Rwanda or in Africa. And the reason is, I think, rooted in the system, in the healthcare system itself. And I usually give an example of fintech. So with fintech, what happens is that if there is a new technology, all these banks are willing to test it. If as a startup you approach the National Bank of Rwanda or any other bank in the ecosystem, they'll be willing to test that technology as long as it's resolving one of the problems they have. This is very different when it comes to healthcare. For some reason, the healthcare providers are so comfortable in this system that has been functioning this way for 100 years plus. And we resist change so much. Anything that's different, especially anything that's digital, they look at it as if you're selling them witchcraft, to put it lightly. So it's not, we don't embrace innovation at all. And as a result, most of the amazing solutions or products that are developed never leave the labs or the rooms where they were developed, because no one is willing to test this. And an example is when we joined the Health Tech Hub Africa in 2022, they usually take 30 companies in Africa, and they had 4 companies from Rwanda, 4 health tech companies from Rwanda. Among those 4, only 2 companies are still functional. I wouldn't say fully functional, but Lifesten and another company. And these people had amazing ideas, amazing products, amazing solutions. But they approached different hospitals for trials that were denied. They went through the regulation systems. It went on for 3 years, and they didn't even have a certificate to show for it. So at some point, they ran out of the funding they had. They pre-seed funding, and they had no other option but to close. So the ecosystem is really, it doesn't nurture innovation. It doesn't, they advocate for it verbally, but we don't necessarily see the actions to support the upcoming innovations. So I'll say it's deep waters. So what I'll recommend, I usually say collaboration. When you are open to collaborating, there are things you don't have to do. There are things that, if I'm working on Lifesten and you have something that Lifesten can be integrated into, or you can integrate Lifesten into, then I don't have to also design the same thing. And I think that's what most innovators do. They'll just say, that technology exists, but they want their own thing, which I believe it takes more time than it should, and it makes the journey harder. So if you're able to approach people who are doing something that's related to yours, you're able to move faster, test it out, and bring it to the market. And the second thing I would say is to the PPP, the public-private partnerships, which is part of the collaborations in a way. And I usually love to say, everything you're doing, leave a paper trail. So this can be research or any other form of tracking, because you can see a startup that's been in the business for 10 years, and they can show the numbers, but there is nothing that shows like tangible data of what they've been doing. And if you can't show it, it never happened. So leaving a paper trail for any activity, any project you're doing, however small, so that you have something to show for it at any point. how do we protect our brand? So there is the usual registration, RGB, and also the trademark registration. I'll say those are the two ones. But also, I think when you have an idea and the fear of the idea being stolen, it's really something at some point you have to get over, because in most cases it's not about the idea, it's about how you implement the idea. And the vision I have for Lifesten will always be different from anyone's vision. So even if you're taking Lifesten, your implementation will totally be different from my approach. So yeah, that's my whole concept about protecting the brand. We do the necessities legally, but then the things you cannot control. Any other questions? I think the reason why we have few healthcare entrepreneurs is because of the challenges I mentioned. It's a very hard space to navigate funding-wise, but also the acceptability of the available solutions. Are people willing to engage with the solution we've designed? Are people willing to pay for it? An example is for healthcare and education. These are services people usually expect to get for free. They feel like, and now that with the insurance coverage, then people expect that, why would I pay for healthcare, especially for prevention? So the willingness to pay is really low. So you have to you get to learn that the user is not a customer. So you have to define your users, but also define the customers, and then go to the customers with a tangible proposal of what do they gain from paying for this. So, and then on top of that, the challenges with the regulations, and then the challenges with simply how the system is designed, because as I mentioned, it's not so accepting of new innovations. So as a result, there is no testing ground. If you're not testing, then simply you have nothing, which is a very, very big issue. And this is why even the ones that start, most of them don't reach where they hoped to, because of all these challenges on the way. So opportunities for collaboration, I'd say very many. One of them is research. Research is something we've really, really invested in, I'd say. Every single thing we do, if it's a project, if it's anything, we want to have some tangible data of what we're doing. So we're open to having research collaborations with other institutions. And number two is joint funding opportunities. If there is a joint project, we can do implementation projects, either on the community health level, or even at the systems level. We'll be interested in that. And then anything focusing on the corporate wellness program. This can be insurance or access to corporates or companies that will be interested in corporate wellness programs. Yeah.
All right. Okay, I think we will take just those two more questions from Kelvin and Patty.
Okay, so the first one about the incubation programs. My take is that first, most of the programs, from experience, they are very, I'd say it's copy paste. So a fintech program will look like a health tech program. and it's not tailored to the specific needs of healthcare innovators or entrepreneurs. And if because also the needs are very different depending on the level of this company. So I always propose for anything to start, for anything to actually give any type of positive outcome, there needs to be a prior assessment. So if you come to me now, I'll give you a list of the 5 or 10 biggest challenges Lifesten is facing at the moment. And then I think the support should be around those. And for another company, they might be different, depending on their focus, depending on their area, depending on their clients, target market, etc. So if it's not tailored to my needs, and then we're going through the usual how to redefine your market, how to pitch, this is not necessarily addressing my pain points. And sadly, I feel like most of the programs are still designed in that angle, like the typical overall vague implementation of, or you need to know how to pitch, you need to know how to design a business plan, market research, etc. And then on the second last question, so for innovators who want to start in Rwanda, I would say before anything, approach the implementers, either the Ministry of Health or RBC, and then you're able to learn about their priority areas. Because anything you bring, if it's not part of the government's priorities or pain points or future plans, then it can be integrated. But if you go to them, they'll be able to tell you, this is where we have a challenge, this is what we're trying to do. And then with whatever you design, it can easily be integrated. And then you're able to bring them along in the whole journey. So they're part of the whole process, which also I'll say works in your favor. And number 2 is Rwanda is an amazing space to test your idea, but whatever you're designing, design it in a way that's scalable, with the end goal not necessarily being Rwanda, the end goal being taking this outside of Rwanda. So can this work for other African markets, Sub-Saharan Africa or other areas of Africa, or even out of Africa? And then the last one is the one I mentioned earlier, partnerships. Who can you work with along the way? Who else can be part of this? So yeah, I would say those are the 3 main advice I can share for upcoming innovators.
Thank you so much, Peace. I think it's been a very, very interactive and engaging episode. I think getting to learn more about the health tech landscape, your journey, and I think some of the opportunities, experience that you've encountered along the way, how you've been able to navigate the obstacles. I think it is quite inspiring. I think at this point, we would love to access more of your work. So I think you can drop the link to Lifesten, I think, in the comment section, for those that are more interested to learn more about your work.
That's the link in the chat, and it has also the link for people who want to download the Lifesten application. It's available both on Play Store and App Store, so feel free to download and engage with it.
Thank you so much. And for participants who might have joined late, but are still interested to catch up to the beginning part of our session today, we will upload this episode on our YouTube channel. We do have a playlist. You can kindly access that through the link that I've shared. So that is a link to our YouTube page. And for those that are interested beyond just the webinar series, they would like to learn more about the CHI hubs in Rwanda, Malawi, and beyond, I've also attached a link to our websites in the comment section.